The four main requisites of performing a good Crystalens implant are a good astigmatic control, a perfectly round and centered capsular axis, an implantation which is absolutely within the bag, and a perfect wound with a completely posterior vaulted lens. You will see here that once the viscoelastic is instilled in the anterior chamber, a perfectly round capsular axis, which is approximately 5.5 to 6 mm in size and well centered, is performed in a very gentle and a controlled manner. Once the capsular axis is performed, it is advised to drain the viscoelastic and perform a good hydrodissection, but making sure that the zonules at no point are stretched or damaged. After performing a standard phacoemulsification and ensuring a complete cortical cleanup, we proceed towards implanting the Crystalens. A high viscoelastic is put in the anterior chamber, ensuring a deep anterior chamber. Enlarging wound secondarily ensures a more stable wound and a better astigmatic control. Once the lens is loaded, the injector is placed within the center of the capsular bag, and making sure that the leading haptics first go within the bag and the trailing haptics follow through, and in the first attempt should be put within the capsular bag. Once the IOL is in, very gently the IOL has to be rotated in place, ensuring that both the haptics on both the sides are within the capsular bag and the bag is well centered and posteriorly vaulted. It is a very good idea to ensure that all the four haptics are within the bag. Counter check by moving the capsular axis and ensuring that the capsular axis is covering the IOL and the haptics on both the sides. Once this is done, a thorough and a meticulous irrigation aspiration to remove the viscoelastic is performed. It is also advised to remove the viscoelastic from behind the IOL, as this may prevent a complete posterior vaulting of the lens. Once a complete removal of viscoelastic has been done, the anterior chamber is inflated with the fluid and ensuring that the lens is deep and posteriorly vaulted. Wound sealing is done by performing a hydro procedure, and after completing the surgery, it is always a very good idea to check the wound for leaks, because a leaking wound may cause forward vaulting of the lens and result in loss of accommodation, and may even require a resurgery to posterior vault the lens again. After the completion of surgery, most of the times it is advised to put a cycloplegic drop like atropine to make sure that the patient has cycloplegic effect lasting for more than a week, after which he can start resuming doing his new work and enjoy the fruits of this wonderful technology. Thank you.